My great Kiwi today is television presenter Sonia Gray. Now, she's taken part in a documentary called Mind Menders, where she takes LSD and ketamine as part of research into future treatments for anxiety and depression. Hi, Sonia.
Now, Gray took LSD and ketamine.
Yeah, that's
what an
right.
intro.
Well, you did.
I did.
Yeah,
I
you
did.
You
I did.
And why did you take it, I guess?
Why did I? God, I never thought I would. I'm not someone that has delved into the drug world. Just I have one of those brains that is unpredictable, and I think particularly psychedelic drugs were just always something I thought were too risky. So, especially LSD. Something about LSD was like, oh my God, I just would
Because
never.
you go on a trip and...
And we've all heard about the bad trips.
Yes, sure. So,
I think I would have had it. So, this was, it took me a little while to decide to do this, but it's obviously very different. This is looking at these drugs as therapy, as supporting mental health in lots of different ways. And I'm curious. I was intrigued. I'm a bit rebellious. And I was like, yeah, let's do this.
Yeah. And
then I went, oh my God, what have I done?
Well, we'll come to that because you're neurodiverse. So let's talk about that. Because the aim was to use these to treat certain conditions you've got. Yeah.
I'll just step back a bit and say, because I've got ADHD, which isn't something that needs fixing, obviously, but there's a lot that comes with being neurodivergent, which is just a lot of anxiety and depression because you don't really fit in the world. The way your brain works and the way the world needs it to work are a little bit at odds. So I have had lifelong anxiety and periods of depression, and mental health has always been just there. It's always there.
A weight.
And it's still, it's just a thing. And I say this because I know that so many New Zealanders are in the same boat. And so we got to just keep talking about it and keep saying, we've got to do better. Anyway, yes, that's why I took part in the first trial was microdosing LSD for mental health. And have I answered your question? No, I forgot what the question was.
You have. No, you've totally
I just
answered
took you
it.
way away.
Yeah. It's like you're on a trip.
Yeah.
Okay, but we'll bring you back.
Thank you.
What happened? Because everyone will be wondering, what happens when you microdose LSD?
Yeah. As in what happens, how do you do it? Or what happens, how do you feel?
Well, how do you do it, first of all, and how do you feel?
This was quite a unique trial. I think it's the first in the world where you get all your tests and stuff done and then you take the LSD home and you keep it in your fridge, which was quite a trip in itself. So twice a week, I just opened this little vial and stuck this syringe thing in and put it under my tongue and held it there and then went on my merry way. You're meant to do something that you enjoy afterwards. I struggled with that.
Yeah. What? Finding something to do that you enjoyed afterwards. What did you do afterwards?
Well, sometimes I walked the dog, sometimes I meditated, but the struggle was I was like, I don't know what I enjoy. I know you're looking at me like,
yeah,
what do
that
you
feels
mean?
bad.
But I think a lot of people are like that. We're like, I enjoy what's good for my kids and what makes you happy. And for the individual, it's like, you feel guilty doing something that you enjoy. So I was pretty crap at that part of it. I got the drug taking down pat eventually, but the doing something I enjoy, I struggled with. And I think initially I could feel just a slight peace and ease. Everything felt a bit lighter, very subtle.
Very subtle, and you didn't feel high or anything like that. You felt in control. No,
and it's I think the term is subperceptual. I think.
That's a cool word.
Thank you. I hope I got it right. So you're not meant to feel anything. So they keep putting your little dose up and until you're like, I think that's enough, until you feel something, then they bring it back down a little bit. So it's very measured.
Yeah, and, people, obviously we wonder, you didn't feel high, but did you feel better? Did you feel like your anxiety in particular was lifted?
Yeah, slightly. And I think that's the big thing with any kind of medication, really, any substance. It's the icing on the cake. So if you haven't got all the other things in your life working, you're not looking after your diet, exercise, sleep, etc., it's not going to do anything. And so the first half of the trial, I was really feeling like, hey, this is really good. Then I got really busy, really, really busy, juggling lots of different jobs, and no amount of LSD is going to change how that affects you. And so, that's when I had burnout. Yeah, it was bad timing.
Yeah, but it shows what real life is like, because this, for watchers and listeners, this is a controlled research experiment done out of the university. It's it's not illegal in any way at all. And you found that it hit up hard against real life.
Yeah, exactly. And people were like, "Oh, but you're doing the LSD, that should help." It's like, it'd be a bit weird if taking a little bit of LSD completely eradicated the effects of working 80 hours a week. It's
it's medicine like anything else, isn't it?
Yeah.
And what do you think? Because this is the big question about all of this, isn't it? It's been an illegal drug for so long, things like LSD, and now we're seeing, hey, it might help us with these problems. Without putting you too much on the spot or pointing people away from the documentary that's on Neon, what do you think now? Do you think that there is room for use of these illegal drugs as medicine, done properly?
Absolutely. Yeah, I do. Yeah. And I think a big part of it, and which you don't get in the trial because it's a medical trial, a big part is potentially looking at it in a holistic way. So taking these substances and going, okay, let's use them like Indigenous people did or do. In ceremony, like just with everyone, like not just sort of me going to my fridge, taking LSD and just going back to work, like I think with all these things, it's a part of the bigger picture, but definitely it could be a really useful, helpful, life-changing tool.
Yeah, right. And that includes, because you didn't just do LSD, as you said, you did.
I moved on. I went, hey, I've started this. Let's go. What else is there? No, it wasn't like that. It wasn't like that.
No, you did. But in a controlled environment, again, you used ketamine, which is a very popular recreational drug these days, particularly amongst New Zealand's young people. You, of course, used it in a controlled research environment again.
Yeah.
Tell us about using ketamine, otherwise known as K. Tell us about that.
Yeah, that was perceptual. I felt that one there. That was a larger dose, and that was pretty trippy. Yeah, it was. It was. I mean, I'd like people to watch the doco to see because we filmed that. But yeah, it was. I don't want to say too much. But yeah, again, I think ketamine is particularly good for depression. They've shown in a controlled setting, and I think it was helpful to me in different ways. Is that enough for you?
Yeah, I think just elaborate just slightly because people will watch the documentary. But how did that help your depression and your anxiety? Ketamine.
My anxiety. I think it. We have the default mode network, so our brain just goes back to the same ways of thinking, and often they're very unhelpful. And it gave me some perspective. It allowed me. Ketamine's sort of a dissociative drug, so it allowed me to kind of look down at my brain and what was going on without being affected by it, if that makes sense.
Yeah, it totally does. And I think people who have mental health problems will know what that's like when you want to try and when you feel trapped in one way of thinking.
Yeah.
So it enabled you to look at that from externally, basically. Which can be super helpful.
Definitely. And I will say that taking ketamine in that kind of environment is very different to taking it on the street because it was measured down to the, little nth degree, and it's, what you're getting and all those things. Because a lot of friends said to me, don't do it, when I told them about ketamine, and they horror stories. And I think, that as...
It's horse tranquilizer is what it is.
Yeah, and the K-hole experience sounds horrendous.
Yes, the K-hole's when you sort of disappear totally.
You can't move.
Et cetera, et cetera.
Yeah. So Professor Glue was my guy at Otago, who was an absolute darling, and he kind of reassured me and told me that there's this little thin, narrow, I guess, window of the amount you give and when you give it and all these things that come into play, and either side of that is either dangerous or won't do anything. So that's why these controlled medical settings are so important for this kind of thing.
Yeah, and it took you to that space. So
Yeah.
just to wrap things up,
Yeah.
Obviously you think that we should have a more open view around using these illegal drugs for mental health. That's, people can see the documentary, but that's where you come through.
Yeah, but with caution.
With caution.
They can do a lot of damage, as we know. But, look at our mental health crisis. We have to look at other options.
Yeah, we have to do something to help our mental health crisis, and these could be it.
Yeah.
Thank you very much, Sonia Gray. People can watch Mind Menders on Neon. I've been watching it. It's fantastic. Congratulations.
Thank you.
And just before you go, a short piece of positive advice for other Kiwis to help them live their lives, something basic. Sonia.
Oh, gosh, you've put me on the spot. I've got so many things I could say. You're not alone, I think, is the big one.
Yeah, well,
isn't
that's
it?
fantastic advice.
And kindness is the greatest drug.
Yeah,
Be
kindness. Yeah. Thank you
Yeah.
very much, Sonia Gray.
Pleasure.
You're an awesome person, and you don't feel alone when you're around, and you're very kind.
You are too.